Hello, everyone, and welcome to the SNAP's COVID-19 office hours. My name is Micah Webster with Apt Associates, and I'm going to spend a couple of moments going over some tech notes, and then we'll get into the content that we have for today. A couple of housekeeping reminders. We are recording the office hours today, as we do for each office hours, and we'll post a copy of the recording along with the slides and any content that we receive through the chat box onto the HUD Exchange in just a few business days. If you have any issues with audio during the webinar, we encourage you to switch over from computer to phone audio at the numbers that are up on the screen and that I have just pasted into the chat. Everyone will remain muted for the duration of the office hours, but we absolutely anticipate and hope to hear from you through the chat feature in WebEx. To find the chat, just take a look at the bottom right-hand corner of your screen. You should see the word chat and what looks like a message bubble. Click on that to open the chat. Please send all questions, comments, and feedback through the chat. And with that, I'm going to turn things over to Norm Suchar from the HUD Office of Special Needs Assistance Programs. Norm?
Thank you very much, Micah, and welcome everyone to Office Hours today. We have a great set of content we want to share with you. I'm going to introduce our speakers real quick, and then we will dive into the content that you're here for. So first of all, just want to show you the list of people who are going to be presenting today or will be resources today. You will hear from Carolyn Waddell from the Centers for Disease Control and Prevention, and she'll give a COVID and other things update for us. We will hear from Brian Roccapriori, one of our technical assistance provider, presenting on some technical assistance materials related to infection control and winter planning, a super important topic right now. We will hear from William Snow, who will talk about the upcoming point in time count. William Snow from the SNAP's office. And we will also hear from Marlisa Grogan from the SNAP's office, who will talk about ESGCV, COVID ESG spending, and how we're doing on that. So we also have several other partners from other agencies and on the call with us today. We encourage you to ask us questions or share with us anything that you think would be helpful for us to know or helpful for our audience to know. You can just do that through the chat window. We are happy to do our best to answer any questions about the content today or any other SNAPs related questions that you might have. And again, just type those in the chat window. So with that, I'm going to turn things over to Caroline to give us our CDC update. Caroline?
Thank you, Norm. And hi, everybody. Just like you said, I am with the CDC on the Special Populations team. And today I'm giving an update about COVID-19 and some prevention measures. Next slide. Here we have the weekly trends in number of COVID-19 cases over time. Cases did plateau after the early December surge, and currently only 16% of the population ages 5 years and older has received the updated bivalent booster. So if you're not up to date on your vaccinations, please consider doing so and consider encouraging your residents or clients to think about getting vaccinated themselves, since COVID is still mildly more elevated than it was before December. Next slide, please. The map here shows COVID-19 community levels across jurisdictions, and around 63% of jurisdictions are green or in that low level category, and that's a 14% increase since last week's community levels. So that's really good to see, increased green on the map. And 31% are yellow or in the medium category, and 6% of jurisdictions are red or have the high community levels as of last week. Next slide, please. These are the proportions of SARS-CoV-2 variants by week, and the XBB 1.5 Omicron lineage, represented in that dark blue on the very right column, accounts for about 50% of infections as of last week, and CDC still recommends the same prevention measures to mitigate COVID-19 regardless of the variant that is circulating. Next slide. I want to highlight some of the guidance on management of COVID-19 in homeless service sites on CDC's website. which I can post right now. I think I had it. Oh, I didn't. I'll send it after my talk. Next slide, please. The guidance outlines some prevention strategies for everyday operations in your facilities that should be in place at all times, as well as some enhanced prevention strategies that can supplement your everyday prevention measures against COVID-19, and they can also be helpful against other respiratory diseases and viruses as well. Next slide, please. Oh, whoops, there we go. So these are some of those everyday operations that I was talking about, including supporting staff and residents to stay up to date on COVID-19 vaccines, to improve ventilation in your facility, to provide testing for COVID-19 when it's needed, and also to wear masks or respirators and PPE as is appropriate, to promote infection control and facility cleaning, and to implement post-exposure guidance. Next slide. Additionally, it's important to implement isolation guidance in your facility, support access to treatment as needed, monitor and communicate potential outbreaks or needs, and then an enhanced strategy with that is to increase distancing, that social distancing that we're all pretty familiar with. Next slide. And you can contact us at the email there, specialpopulations@cdc.gov. And any of the numbers listed there with any questions that you may have about specific context for your facility and how to better prevent COVID-19. So thank you so much. Back to you, Norm.
Thank you so much. And I should say that the guidance, the recently released guidance, has been just so helpful to our communities. So thank you so much for that. You talked a little bit about the changing sort of nature of the variants and how, you know, that's shifting over time. So like, what should people be doing, or how should people be thinking of that? Are there sort of changes people should be making, or you know, what advice do you have for people?
Thanks for that question, Norm. So I know in the news it can be really scary when you hear about another variant that's out there, but CDC is still recommending those same everyday mitigation measures and then the enhanced measures. And so you'll still be using the COVID-19 community level that you can find on CDC website to tell you about the green, yellow, or red for your community. And based off of that, you can either choose to do green or yellow, those everyday prevention measures that I mentioned in the past couple slides. And then if you're in the red, that's where the enhanced measures are recommended. And there is a caveat there that if your facility has certain characteristics like high staff turnover or client and resident turnover, or people that may be more likely to have severe outcomes from COVID-19, like older age or other immunocompromising conditions, then you can consider having those enhanced measures, even if your community level is lower. So we still recommend those same things regardless of what is circulating, which variant is circulating. So thanks, Norm.
Great, thank you so much. Helpful information as always. If anybody has any questions that Carolyn can answer, please go ahead and type them in the chat window. We'll move on to our next presenter today. So I'm very happy to introduce Brian Rockpriori, one of our fantastic technical assistance providers, who is going to be talking about some of the infection control and winter planning technical assistance products. So Brian, over to you.
Thank you, Norm. Hi, everyone. Brian Rockpriori. We can go to the next slide. My colleague Laura was here last month and she introduced the series, and I'm back this month because the second video in the series is now available on the HUD Exchange at the link that just went into the chat. And because of how timely this is, given the real world situations that we're all facing. And by that, I mean it's wintertime and a lot of folks are inside and we have several infectious diseases that are increasing in number. So the infection control and winter planning series, it was created to really assist communities in their winter planning and how to implement their infection control measures. The second video in the series that was published this week is designed to help shelters, COCs, develop and implement communication strategies to keep both staff and residents safe during the winter. And this isn't just our hot takes on messaging, it's a lot of information that comes directly from us co-creating the messaging with folks with lived experience of homelessness. The video itself includes onboarding information for new staff, messaging for residents in emergency shelters, as well as how to access materials and really how to work together with your public health organizations. So who are we trying to reach with all of these? That's a great question. Our target audience here is shelter providers, COC leads, and really any organization that serves folks who are experiencing homelessness. The videos themselves are just a couple minutes long. They're pretty easily digestible and just super easy to share with partners. And the great thing about them is they all have links to resources that go way more in depth, but they really stand alone and do a great job of communicating the core messages. So the first two videos are available now, and the other three are in production, should be available shortly. Stay tuned to your HUD Exchange emails for those. And please share and share widely with all of your networks. That would be greatly appreciated. Now, on the next slide, we're facing multiple infectious diseases. The flu, RSV, COVID is surging again in some areas with the XBB 1.5 variant. And Caroline was saying before, the bivalent booster, while doing an amazing job of keeping people healthy, has had a less than ideal uptake by everyone, not just people experiencing homelessness. I believe the number that was cited was 16% of the general population. And I know that everyone's over this. And when I started talking, a bunch of people probably checked out, started multitasking. And I'm going to keep saying this because it's one of the more important things that we can do to keep folks safe. And a little work on the prevention side is going to go such a long way in helping reduce work, reduce effort, reduce money spent, and ultimately help save lives of people if you do experience an outbreak. So I will come down off my soapbox for a moment. And again, what Caroline was saying earlier, that the CDC is still recommending the same prevention measures regardless of what the variant is. So I wanted to take the opportunity to reintroduce some of the existing work that can help support you in these times. All of the links are going in the chat now, and I'm just going to briefly run down what they are. The first is a flyer for homeless providers to help address any concerns about the updated booster. It goes over things like eligibility, potential side effects that people might experience. Excuse me. The next is vaccination in unsheltered settings. It goes over all the things you can consider to set yourself up for success in this situation. And the important one here is I really want to highlight the part about you don't have to make it COVID specific. And that goes for all vaccination efforts, really. Wrapping it all up in a larger healthcare outreach event is a great way to more holistically engage folks and increase that vaccine uptake. Third is our vaccine messaging toolkit, which the video that I was talking about earlier heavily draws from. There's a lot in there about engaging with different partners, meaningful messaging, and again, was all co-created with folks who are experiencing homelessness. And last is the general page of disease risks and homelessness, which is searchable by keyword. It's super easy to find stuff based on what you might need in your specific community. And it likely has everything you could need to help implement prevention infection control measures. There's a ton of great community examples, workflows, good, better, best scenarios for things like isolation and quarantine. And I will say that I understand that life sometimes comes at you fast, and a written product or a video might not be the perfect thing in the moment for your community that's experiencing an outbreak. So if anyone out there is experiencing an outbreak of any kind or needs some extra assistance, some extra support, there is help available on the technical assistance side. And the best way to do that is to submit an AAQ, the HUD's Ask a Question desk. That link is going in the chat right now. Thank you, Heidi. When you get in there, there is an option to select what your question is related to. You would select homelessness and infectious disease questions, and there are TA providers on the other side who are here, ready, and waiting to help. So I'll just leave you with, like, you don't have to do this alone. Please make use of us. And that is what I had today. So Norm, I can give it back to you.
Thank you so much, Brian. Wondering about the upcoming videos. Can you just sort of give us a hint about what some of the content might be that are going to get covered in the upcoming videos?
Sure. Give me just 1 second because I had that open right over here. So the next one is going to go over personal protective equipment, cleaning and disinfection, how that presents itself in in emergency shelters and homeless service sites. The next is going to be isolation and operational considerations for congregate facilities. And then non-congregate shelter. There's going to be a video dedicated to best practices there and really goes into the good, better, best scenarios of that. So it's not just everybody should have the same, their individual room, individual bathroom. We know that's not a reality in a lot of situations. So it gives real practical examples of how folks can implement to the best they can with the situations that they are currently facing in their own systems.
Great. Thank you so much, Brian. I also, just to piggyback on your comments earlier about the importance of vaccination, I also, if it's just for the 1 out of 5 or so people who have gotten the bivalent booster, I did get the bivalent booster. It was great, and definitely gave me a little more confidence about things. But I do want to just thank everyone who has taken, whether big or small, measures to help prevent the spread of COVID, whether it's putting on a mask or getting your booster shot. The thing about it, pandemics and large infectious disease outbreaks is that little actions can make a big difference. And so I just want to, take a moment to thank everyone for the sort of little actions you may have taken. They really make a big difference. I know in this world, we always think about what isn't being done, what's next on our list or whatever. But I do want to take a moment and just thank everyone who has taken some steps to help move us forward and help prevent the spread of COVID. So thank you all, and thank you, Brian. And we're going to take one of those great hard turns into a completely different topic. I'm happy to introduce William Snow from the SNAPS office. William is our point in time count subject matter expert, among many other things. So William, I'm going to turn things over to you to talk about the upcoming pit count.
All right. Thanks, Norm. Excited to talk about the point in time count. Next slide, please. So just as a reminder, last month we released the 2022 data. So if you haven't seen that, I'd encourage you to look at the Annual Homeless Assessment Report Part 1, or the AHAR Part 1, where we talk about what you all did last year, what we saw. It was a historic year. The first count after COVID had really kind of hit us, so first national estimates. That actually makes this upcoming count, which is kicking in really next week, historic as well, right? We're starting to see, or we'll get the opportunity to see what happened with a lot of those resources that you all have spent so much time making sure have been useful to your community and protect those that you're serving. So we're very grateful for that. I thought I'd do just a quick primer on the point in time count. Again, step back, let's know what it is, let's know why we do it. So the point in time count is a one-night count of people experiencing homelessness. We have lots of data collection. What makes the point in time count unique is that it provides not just the one-night sense of who's in shelter, but those who are in unsheltered situations as well. It's in fact the only data source for the nation, at least, that provides a snapshot of that unsheltered population. It's so critical to get that. Getting the full picture of people engaging in the sheltered system and people who are not in the shelter system gives us a great idea of who's out there, what are the needs. Most pit counts are conducted in such a way that they're heavily engaged in interviews. So we're talking to who's out there, trying to understand, again, what is their demographics, again, who's out there and how can we serve them. Just a reminder of the scope of the point in time count. It is focused on people in sheltered situations as well as unsheltered. We don't collect data on people in doubled up situations or in other precarious housed situations. So I just want to flag that there's sometimes some confusion and frustration around what you get or don't get out of the point in time count. There's some good reasons for that, right? It's actually a ton of work just to do the counts as they're currently structured. It takes census about 10 years and billions of dollars to do a full census of the country, and that's the type of effort that you would need if you want to find out what's going on with the doubled up population. So we use the point in time count in context with other data sources to help us get a more rich picture of what's going on. So I want to flag that. It's really important to understand what you get and what you don't get out of the point in time count, and really recognize the value of going and engaging with your community in doing your point in time count. The count is done at the end of January. That's a cold time of year. We actually get lots of questions. Why do we do it in January? Based on research, we found that this is the time where we find the highest national average or highest national data on people experiencing homelessness in a single night. We know that the sheltered and unsheltered dynamics change in different areas, right? I imagine places like Minnesota or Chicago are probably going to have a higher unsheltered number if you count them in the summer. But overall, we get a higher total count of people experiencing homelessness by doing the counts in the winter. So we do that. Another reason we do the winter, which kind of gets at the larger reason why we do counts at all, it's kind of crazy to think that in the middle of January, you're going to find over 200,000 people sleeping on the street, or at the end of January. That's insane, right? Even in places that are a foot or two in snow, you're still finding people outside. So it tells a reality of something that we don't love, right? The reality that people are sleeping on the streets, outside, and we need to know who they are. We need to be able to find ways to serve them, and this is one way we do that. Another reason we do the point in time count is to engage the public. They're going to see these numbers. This is one of those popular things that gets picked up by the press, and it's a good starting point for what is happening in your community with regard to this important population. And hopefully it sparks some interest and you're able to get more volunteers or more political support in terms of the need and the resources to address homelessness. So the point in time count serves lots of purposes. We're hoping that you don't just do the count, put all of these hours into it, and then put all that data on the shelf. We hope to take that data, get a sense for what you're understanding, especially on your unsheltered side, and using it. We saw a lot of communities show that they are using that data in our last NOFA, the special NOFA, where they provided their unsheltered data and talked about it. We appreciate that, and we will try to do things that actually continue to help you to look at that data. We want you to make it a part of your planning, a part of your efforts, and we appreciate it. We know this is something that takes hours of staff time. Often you're engaging volunteers, truly a community effort, as it should be, because this is something that should be solved at the community level. And we're just grateful that we can participate in that. So I want to give you all a big thank you for all of the work you're doing. We know, again, all that's going into it so far, and next week's going to be a big week for many of you, and we appreciate that. And with that, I'm going to turn it back over to you, Norm.
Thanks so much, William. I think, want to express appreciation to everyone working on point in time counts. One of the questions we often get is about, it's always a challenge to do the count on one night, and people are looking to sort of try to do the count over, a week or so. Can you talk about like what the options are if people are looking to do a count that's, spread out a little more?
Yeah, we love that question. So this gets at the methodology that a community is using. If you're doing a count where you're really basing your count on observation, this is how counts have been done for several years, then you actually do need to more or less do it on a single night, because you need to find a way to be able to deduplicate who you're finding, right? So we're not double counting anyone. But most communities now are no longer doing a strictly observation count. The most prevalent type of count is an interview-based count, right? Where you go out, you sample, you try to count as many people as you can, engage them, hopefully in a relatively short interview. I know we have requirements in terms of what you need to ask, what data is needed. Hopefully there's not much more beyond that communities are asking for. As you do that, it actually opens the door for you to have a longer count. You can pair this effort in a one night with a service-based count, or you can do it over multiple days. The key there is if you're collecting on someone's identifier, maybe a name or a location, but particularly a name or some other way to distinguish, you can deduplicate. And so as you do a multi-day count, you're able to ensure that you're not double counting anyone. So we encourage you actually, if you are doing an interview-based count and you have the resources, take a couple of nights, and preferably in the night. Sometimes you need to use the daytime to engage certain populations in particular, but we found more success happens as you continue to engage people where they're sleeping, but also using those service-based opportunities, libraries, food banks. They're just fantastic partners and really enhance the information you get in your counts.
Great, and we have another question in the chat about how the point-in-time count reflects people with disabilities. Can you talk about that?
Yeah, that's a great question. It's one that is difficult, right? So if we're counting people in the middle of the night, asking about a variety of things, everything from your housing status to your demographics to your veteran status, we do actually have some questions around disability. We ask around severe mental illness. We ask about substance abuse, HIV/AIDS. So those are asked, but I will put a caveat there that, again, knowing the context, you're doing this in the middle of the night, I'd say that data should be looked at with some caveat. And if someone's going to look at it, they actually should try to also look at what information you're getting in your HMIS data, right? What are the trends you're seeing throughout the year? It's a great example of the PIT count's a good starting point. It lets people know what's going on a basic level, but to really understand, you're going to need to dig into HMIS and other data that's collected on people experiencing homelessness in your community.
Great, thank you. And again, want to thank everyone who's working on point-in-time counts. I will say this data is really useful. This data was really the basis for the unsheltered NOFO, as William mentioned, that we published last summer. And, you know, it really is sort of central to the policymaking process here at HUD. And I know it's a really crucial for a lot of communities and in thinking about how they develop homeless assistance and how they, you know, make a case for resources to their local and state governments. So thank you all for your roles and your work on doing those point-in-time counts. So thank you, and thank you, William. So we're going to move to our next topic. We're jumping around a little bit here, but our next topic is ESG-CV and how we're doing on our overall spending. So this is your chance to see how your community stacks up, or at least get a sense of how everyone else is doing, and then go back and look at your own data. But Marlisa, I'm going to turn things over to you to give us our update here.
Okay, thanks, Norm. Hey, everyone, Happy New Year. We wanted to turn everyone's attention back to ESG-CV, with this being the home stretch from now until September of this year for spending ESG-CV funds. Next slide, please. So this gives you a snapshot as of January 13th of where everyone is. And so we have 169 grantees comprising 47% of the whole recipient pool that have drawn down over 80%. But you can see that figure, or the span of progress and draws, really reaches the whole gamut of status. And then the pie chart right next to it gives you a similar representation. The vast majority of you ESG-CV recipients are between, like, at least 80% drawn, or between 60 to 80% drawn, but we do have a cohort that's under that percentage. And this next slide is for you. So with 74% of the ESG-CV allocation drawn, there's still a lot of room to increase and intensify your efforts in drawing down funds regularly. So we have $101 million that's still not committed in IDIS. And we have $8.8 million in grants not loaded in IDIS. And that is directly related to the IDIS, or I'm sorry, the reallocated funds that went to recipients that have not yet processed their grant agreements. Maybe they haven't signed their grant agreements and gotten them back to your field office, or you may be in a variety of situations. But we're highlighting this to make sure that you're taking the necessary steps to identify how you're going to be using your funds, making sure that you're setting up those activities in IDIS and you're budgeting them, you're committing them in IDIS, so that you are in the best possible position to meet the deadline and draw down funds without leaving anything on the table. Next slide, please. So some of the things that are important to know is that draw rates have been down over the last few months. On a weekly basis, we have our awesome TA provider, Heidi Schilp, who does a rundown for us. And we see how collectively all ESG-CV recipients pan out. And we're looking to see that about $27 million is drawn down to keep us on target if we're just going to do like a simple projection for meeting the target. And right now we're down about, we're around 17 million a week, or even less, which is understandable due to the holidays. But this is giving us the flag that we need to really intensify our efforts to get the money out. So what you can do is assess your own progress to make sure that you are on target to fully expend your funds by September 30th, 2023. If you are using the same rate of draws that you're doing right now, whether you're doing it on a quarterly basis or a monthly basis, if you were to keep drawing down funds at that rate, are you going to have money left over by the September 30th deadline? And if you're not, it would be a really good time to start shifting your approach to draws, increasing the draws, and we're at least assessing what the holdup is. What is the obstacle to you drawing down more funds more regularly? So the other thing to consider is that you should be identifying that you should project the amount of HMIS and admin funds that you're going to need for closeout. So for final reporting, reconciling your own internal financial records with what's in IDIS, those types of things, how much HMIS and admin funding are you going to need to do that? Because those funds you can have until December 31st, 2023 to expend. So now would be a good time to figure that out, how much you're going to need, and then start budgeting those funds aside so that you're concretely planning for what you need to spend by the September 30th, and then what you're going to be setting aside through December 31st. And if you have any concerns about not meeting the deadline, please reach out for technical assistance. If you have a technical assistance provider you're already working with, then reach out to them and make sure you're having that conversation. If you don't have a TA provider you're currently working with, submit an AAQ or a request for technical assistance, or even reach out to your field office or your SNAPS desk officer and just say, we're not really on target right now. I don't know what to do, and I don't know what to spend my money on, but we know that we're not going to make the deadline. That is perfectly okay, and that's the first step to getting back on track. So we really welcome that kind of outreach, and I'm sure you will have a response that includes a lot of great ideas for how to use the funds. Vaccine incentives, or additional protective measures, or increasing spending on rapid rehousing, or looking at subrecipients that are slower spenders and seeing if it makes sense to shift funds around if possible to subrecipients that are spending more quickly and running low on funds. So we are definitely here to be a thought partner So please don't be a stranger if you are doing this kind of assessment and feeling like you're not quite where you need to be. So that is all that I have. And before I turn it over to Norm, I just want to flag that we're going to continue these types of status reports and are working on providing additional technical assistance on our end to help you all meet those deadlines. Thank you.
Thank you so much, Marlisa. We did have a question in the chat about, does the expended by date, is that equivalent to the date from which funds are drawn from IDAS?
Yes. So that's a really good question that confuses a lot of people. The expended by date, the September 30th and the December 31st deadlines are just for costs incurred. So that is different from actually drawing the funds down from IDIS. So you need to have the costs incurred by those expended by dates. And then you have an additional 120 days to draw them down. So we're just talking about expenditures, which would include costs incurred as well as drawn funds. But as long as you are incurring the cost, we would consider that an expenditure.
Great. Thank you so much. One thing I just want to sort of build on Marlisa's comments here is that we all kind of have the same goal. We at HUD, our TA providers, and you all want to use this funding for good purposes and to make it as easy as possible to do so. So if you reach out to us, know that we are on your side on this. We have the same goal. We are very invested in you all succeeding and want you all to succeed in this, and really would love to jointly problem solve or work with you however we can to help make that happen. I know that we're at 74% expenditure right now. That just took an incredible amount of effort on a lot of people's parts. I know many of you on this call have been on calls since the beginning and have been like overwhelmed with the work it took to launch this program, to keep it moving, to keep the draws going, all those fun things. So thank you so much for that. It really has, made an incredible difference in the lives of a lot of people. And thank you, Marlisa, for giving us an update, and we look forward to seeing this progress in the coming office hours sessions. With that, I think we are at the end of our time. We do have some lists of resources that we like to post here. We will post this, the slides and all the materials in a few days. We'll try to get it up as quickly as possible. And in the meantime, if you have any questions, again, Brian, or need for technical assistance, Brian helpfully included a link to the AAQ where you can get some more technical assistance. And lastly, I just want to thank everyone for the unbelievable work you've been doing through the winter and for the past several years to prevent the spread of COVID, to help people who have really been struggling and who are unsheltered and really struggling with homelessness. And you guys have done amazing work, and we at the SNAPS office just can't appreciate you enough. So with that, I want to wish everyone a great rest of your day, great weekend, and that concludes the webinar.